Well, good evening, everyone. Brockton's a city of about 100,000. We're situated about halfway between Boston and Foxborough, home of the defending Super Bowl champion. And I already have a bet going with the mayor of Philadelphia. I think a pretty universal challenge most of our cities face is the opioid addiction crisis. And it's been one of our priorities fighting this fight for the last number of years. In the city of 100,000, we average a little over 100 overdose deaths per year. We do over 100 Narcan saves a month with our first responders. It's an issue for us. And when we mayors get together, we all talk about first responders who are on the front lines, Narcan treatment, all of those things. The thought occurred to me a little over a year ago that city government is also, in my city, we're the 4th largest employer in the city. And if we're going to get, and we all know as mayors that local government can't do everything by itself. And one of the pieces of this puzzle is we need employers and insurance companies to adequately cover treatment, including medically assisted treatment. And so we changed our group health insurance this year to include full coverage for medically assisted treatment. And despite 14 different unions that I bargained with, we did it unilaterally and did not ask the unions for anything in return, and it covers not just our employees, but all of their dependents, because we have to remember as employers, we have families that are working for us, not just employees. So I think that we have an opportunity as employers to be role models and cover medically assisted treatment. And the other thing we did as an employer this year is we negotiated a drug policy with our public safety unions. It's now being rolled into all of our other city union contracts. But it's a drug policy that's compassionate, built upon helping people get well and get back to work, and only after several failed attempts does an employee actually get terminated. And we think it dovetails very nicely with our expanded coverage by our health insurance program. So I just suggest to you to think about not just the city being fighting this battle in the front lines, but think about your responsibility as an employer to the people and families who work for you. Thank you.